Hi, welcome back. My name is Heidi Beidinger. And so here we are, another week of tracking the COVID-19 data here in St. Joseph County, as well as Notre Dame and Indiana. So let's go ahead and jump into the data, shall we? So as we start each week when we're discussing the data here in St. Joseph County, you're familiar with this chart. This is reflective of the new cases on an average 7-day rolling average here in St. Joseph County. So again, how do we compute this data? We look at the previous 7 days of positive cases and divide by 7, and then that gives us a 7-day rolling average for a particular day. And you guys, as you can see, this chart is virtually unchanged in its trajectory. We are now in what is called an exponential growth curve. We are just continuing to see huge increases in COVID-19 here in our community. When we started out, we were seeing on average around 40 cases each day, approximately. Here we are now, coming into about 2.5 months later or so, and we are now seeing on average 274 cases per day. This chart is for the active cases, again looking at the preceding 14 days. So this chart is telling us how many active cases are in our community on any given day. And this statistic is computed by looking at the previous 14 days of active cases, dividing it by 14 to give you an average of what we are experiencing on any particular day. And very similar to the chart we were just looking at, we started out relatively low. We thought it was high back on September 10th at 847 cases per day. But as you can see now, we again are in this exponential growth here in these last 2 weeks or so. And where back on September 10th, we had 847 cases, we are now at 3,246 cases. That is about 4 times where we were 2 months ago. This chart is the percent positivity. So this statistic tells us of all of the people who are testing on a particular day, how many of them are positive. And then it gives us this number. So again, let's go back to when we first got started on September 10th. We were testing, the percentage of people who were testing positive was around 6.4%. And we have been relatively unchanged until just now in early November. And now within the last 2 weeks, we are seeing this significant growth in percent positivity. So that means that there's an increase of persons who are taking the test and are positive. So right now, 9.8% of people on average who take the test are going to be positive. That's roughly 1 in 10 people in our community who test are going to be positive for coronavirus. Here's the naught estimate. Again, this is a statistic that indicates community transmission. When we see an R naught that is above 1, that indicates that transmission is increasing and occurring. And when we see an R naught that is below 1, we know that the cases are shrinking and that there's less community transmission going on. So we've seen this increase, we saw a small dip, and now of course in the last 2 weeks we're seeing an increase. And if you notice, during the last 2 months since we've started this, we've not seen these numbers yet, 1.22 and 1.29. So we're definitely seeing, and as we already knew from the other statistics, we're seeing an increase in transmission in our community. So last week I presented this chart from the New York Times, who keeps statistics on every state in the United States. And interestingly, you should know, I think they have on there right now that 47 out of 50 states are seeing uncontrolled spread of coronavirus. So last week I shared this chart with you that that we were having an 88% increase in the number of cases, a 37% increase in the number of deaths, and a 27% increase in hospitalizations. And now here we are a week later. So last time it was November 9th. We're now at November 16th. And again, the cases are increasing, but in even a more dramatic way. There's been an increase of 111% in cases, 20% in deaths, which is actually slightly down from last week, but a huge jump in hospitalization, up 47%. And as always, I would not be doing my service as a public health expert in explaining how it is that we use these data to make decisions in our community. We have information on new cases. We have information on active cases and the percent positive and the RO. And then we listen to our community. We meet with leaders. We talk to the CEOs, to physicians, healthcare providers, to hear about what's happening in the community. And then we make decisions about what needs to happen in our community. And as you guys know, coronavirus is increasing significantly in our community. And it is going to be up to us to get the coronavirus headed in a different direction and to attempt to flatten the curve once again. So here are some of the things that we're hearing from the community. Number one, we're hearing about healthcare provider illness, burnout, and shortages. There's a huge concern that that healthcare providers who test positive might actually continue to work. This is happening in several locations now in the United States. Because of shortages, people who are testing positive are still being allowed to work. We're also hearing that hospitals are at capacity in St. Joe and Elkhart counties. You guys, this is very concerning. We are at capacity. And we are not at the peak of this yet. And so this is going to get worse, and we need to be prepared for that and understand it when it occurs. We're having a surge right now with no signs of slowing yet. We're also hearing from our community. Our community is talking about what plans are we making for Thanksgiving? How are we going to minimize transmission, and how are we going to protect ourselves and our family and our loved ones? I would love to hear more about what you're hearing in the community, and you can email me at consider@nd.edu. But it's really important at this point for us to start sharing stories about what's working and how you're keeping yourselves safe. And finally, I pulled this from the CDC website. These are the recommendations for Thanksgiving and gatherings. And I don't think that there are any real surprises here. But I think these are all worthwhile to repeat because frankly, we're in this together. And if we're going to figure out how to flatten this curve or at least start limiting the transmission of coronavirus, these are the kinds of things that we have to be paying attention to. So as much as possible, can we host outdoor activities rather than being indoor? Can we try and limit the guests to people at our gatherings that are here from the local area rather than importing it from another area? Can we limit the number of guests as much as possible? Can we encourage our guests to wear masks and to use hand sanitizer while they are with us? And then can we ask guests to strictly avoid contact with people outside of their households for 14 days before gathering? And I know that's a tough one, but those are the important conversations that we need to be having with each other. We have to vet each other's plans and ask each other questions about what their level of risk is and also what their comfort is with the risk. It may be different than ours, and we need to be able to assess those things so that we can ensure that we have safe gatherings this holiday season. And as always, here are the data sources and my email at the lower part of the screen here, consider@nd.edu. I did add a new one for the New York Times where you can get interactive data by state. So I encourage you to check that out. So that's this week's data here for St. Joseph County and Indiana. I hope you all stay safe, and we'll see you next week. Bye-bye.